So the number of COVID cases, it's rapidly escalating day by day. The CDC is reporting 37.5 million positive tests. That's where we are, folks. Hospitals nationwide, they're running out of beds. They're running out of staff. And states like Florida, Louisiana, Arkansas, Texas, and Oregon, well, they're so overwhelmed with COVID patients, they're having to treat patients in the hallways, the parking lots. Some staff have had enough. They say, I quit. Nurse Alice Benjamin joins us now to shed some light on what's happening in these hospitals across the country. Thanks so much for starting your day with us. You're up early, you're out in LA, but I suspect you have some sleepless nights. I want to know, if you could, describe what you're seeing, what you're hearing from your colleagues who are still, after all this time, in the depths of treating COVID-19 patients.
I think, we're 18 months into this pandemic, and a lot of my colleagues are getting tired. Nurses, physicians, respiratory therapists. I mean, we've had to fight for PPE to keep ourselves safe. Now there's a mandate for vaccines, so we can make sure that we also keep our patients safe. And I think at this point, we're at a breaking point, and it's called burnout, basically what it is. And we're getting really tired. And I think many of my colleagues are deciding to leave the bedside.
Yeah, and I can hear just the emotion in your voice. And I don't think it's just because it's early. I think you're stressed out. And I wonder what you make of people, because sometimes if I'm in the mood, I get into arguments with these people. They're online saying things like, well, do you. Let people make their own decision. Just do you. People don't understand how not wearing a mask or getting vaccinated, refusing to do that, it creates a domino effect. Yes, you get sick, you go to the hospital, there's no bed for you, there's not enough of people like you to treat them. So talk about the emotional toll, the mental health toll on nurses.
Well, I think it's important for people to know that nurses make up 90% of the healthcare workforce. So we really need our nurses. And we're experiencing what we call compassion fatigue. And it's exactly what it sounds like. Nurses, we have a lot of compassion. We'll take care of you. We'll do anything to help keep you alive. But 18 months in, when we know that there are interventions and things that you can do to prevent this, but deciding not to, that's starting to wear us down here, because it didn't have to be this way. You didn't have to come to the emergency room. You didn't have to contract COVID. There's a vaccine. And at this point, with compassion fatigue, sometimes we can become a little short, a little less patient. And mind you, it's nothing personal towards you. It's just we are getting fatigued that people are making a conscious decision to not get vaccinated when we know that these vaccines work. They keep you at the hospital and they keep you alive. And it's not just nurses, it's everyone in the healthcare workforce. And I think nurses are getting to a breaking point. And it's a very stressful job.
Wow.
Very stressful.
Yeah, we're watching people like you walk right off the job, say, I quit, sometimes in droves, in unison. I want to know about something else, because you're not just treating them. You're watching people die. People who said, I'm not going to get the vaccine. And before that tube goes down so many of their throats, what do they tell you about what they wish they would have done?
I think the number one thing that we hear is, I wish I would have gotten the vaccine. That's the number one thing we hear from people who are unvaccinated that enter our emergency rooms. They're very sick, oxygen levels dangerously low. They're just huffing and puffing at rest, and they're struggling to breathe. And so one of the things I always hear is, I wish I would have gotten vaccinated. And so it's heartbreaking. It's heartbreaking because you could have gotten vaccinated. It's free. You can go to your local drugstore, grocery store, get a vaccine and prevent all of this. And not only is it impacting them, but it's impacting their families. I'm seeing people come in positive for COVID, but then their entire families also contracted COVID. And, it's a very ugly thing to watch. If I can just say, it's a very ugly thing. It's a very, it just brings you to tears to see these things, knowing that it could have been preventable.
Nurse Benjamin, you knew what you were signing up for. It's not like you haven't seen horrific things. You chose to give your life to service. What's so different about what you see when it comes to COVID-19 and the dark side of what's killing people?
It's definitely a dark side to this. And Sharon, I have to be honest, in nursing school, we're trained to take care of patients. But, when you run a drill for an emergency, we never knew that we would be in something like this. This is a world pandemic, a crisis. I mean, when you're running out of PPE, can't say that I was truly trained or prepared for this. And couple that with the burnout, the high stress environment, the constant deaths that we're seeing around us. Some of the colleagues have decided to leave the bedside, and that adds more burden to the emergency room and the ICU. We're already in a nursing shortage. And so, people are leaving for burnout. They're leaving because, they're like, I'm not dealing with this. I'm going to go ahead and retire. And 50% of our workforce are above the age of 50. So if they all retire, if they all leave, that's going to further our crisis and demand for staff.
Yeah, and there was already, we've known about it for years, right? Already a shortage. We need more nurses, right? The pay has increased, but not nearly enough. And when you take that and look at what it costs to treat a COVID patient, what, $20,000 more, that could be used for other things, more nurses, more staff. What is the solution? Speak directly to people watching at home. What do you need from them? What do nurses need?
Nurses need people to take their vaccine. We need you to get the COVID vaccine. We need you to protect yourself, your family, and your friends. And that's one part of it. We also need to increase the number of nurses. So we invite people to join the workforce and help to take care of people, because over the next 10 years, we will about 1 million nurses will retire. And if we don't keep up with the growing population, people are living longer with more illnesses. We don't have enough faculty to teach nurses. Every year, about 80,000 applicants get turned away. So there's a lot of things that we need to do to rectify this. But the number one thing that we can do right now is for people to get vaccine and not overload our hospitals. Hospitals are struggling for staff. They're asking for travel nurses. We're robbing Peter to pay Paul because there's a shortage everywhere. And especially in some of the critical care areas, ICU, ER, 60% of nurses work in the hospital, but only 10% work in those critical areas. So imagine everyone's coming in critical. Where are we going to get the properly trained staff to take care of you? So help us help you is basically what I'm asking the public. Get vaccinated and save yourself and your families.
I said I could hear the emotion. I can see it. You care, Nurse Benjamin. I'm going to pray for you, sis. I'm going to pray for all nurses and you frontline workers, because it doesn't sound like you're asking for that much. You're asking people to live and help other people live. So thank you. Board certified cardiac clinical nurse specialist Alice Benjamin. I hope you'll join us again, update us. And I mean what I say. I'm going to pray for you. Thanks for starting your day with us.